Hello, namaste and welcome to Let's Talk Health, a public interest initiative by Apollo Hospitals. Hi, my name is Dr. Shubham Pant and today we're going to talk about how to keep your bones healthy. But how important are our bones? Let's find out.
The 206 bones in a human body are vital pillars of support. They provide structure, they protect organs, they anchor muscles and store calcium. When you're young, your body makes new bone faster than it breaks down old bone, and your body mass increases. Most people reach their peak bone mass around the age of 30. After this age, you lose more bone mass than you gain, leading to a thinning of bones, a condition called osteopenia. When osteopenia progresses, causing more thinning, your bones become brittle. Brittle bones equals osteoporosis. More than 1/3 of urban India suffers from osteopenia and 8%, mostly comprising of women, have progressed to osteoporosis.
And to tell us how bone health is so important, please welcome Ms. Shobna Kamaneni, Executive Vice Chairperson, Apollo Hospitals. Shobna, welcome to the show.
Hi, how are you?
Hi. So Shobna, we saw that very sobering AV right there.
I know.
So tell me, why is this such an important topic in nowadays?
We think that the other things are so important, but because you can't see your bones.
You can't see your bones,
and
that's right.
we don't realize how it's a slow deterioration. When your bones are healthy, you actually have so much more energy. And every morning, as I think you get to our age, not yours, mine, you get up with this niggling pain, something is paining, or even after a hectic workout.
That's right.
So, important show.
So this is a very, 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 very important topic and important show, right?
I'm really happy that we're doing it.
That's great. So to tell us more about bone health, because it's becoming an epidemic, please welcome Dr. Raju Vaishya. He's a Senior Consultant Orthopedic Surgeon at Apollo Hospitals. Dr. Vaishya, welcome to the show. Thank you. Please.
Hi, doctor.
Okay, tell me this, we saw that AV and it said till 30 you gain bone mass and then after you lose that. So I'm definitely losing bone mass now. So tell me, why does this happen and how can we prevent this?
The most important thing in childhood is if you increase your physical activity, you gain bone. So if you develop adequate bone bank account, then you can utilize it in later years.
It's like a bank account. Start building it early.
Correct. What's happening in modern times, children are forced to remain indoor. So they hardly go out to play. They hardly get adequate calcium through milk products, etc. And hence their bone account is less. They are more liable to, and they are living now longer. So they are more liable to have osteoporotic related fracture in
that means thinning of the bones. So osteoporosis means thinning of the bones. So
fragile bones.
So tell us, what is calcium, what is vitamin D, and how is it important to our bones?
See, calcium and vitamin D are the two most important ingredients of bone, which make the bone strong. And you should have at least 1,500 milligram of calcium per day. Vitamin D is an important hormone which regulates the calcium absorption.
So it helps in the absorption of calcium?
So simply taking calcium will not make your bone strong. You should have adequate amount of vitamin D along with it. Unfortunately, in India, most of the food items which we eat, including milk, is not fortified with vitamin D like it happens in Western countries. So despite having plenty of sunshine, as you said, we are more than 90% of our population is vitamin D deficient.
When should people start measuring the vitamin D? Is there an age when we should start measuring our vitamin D levels?
My recommendation is that you must have at least vitamin D estimation through a simple blood test once a year, if not twice.
And another point important is that people think vitamins are they're like candy. Some people think they just take it, on their own. But I think the important thing is if you're taking higher doses, you should go to a doctor and get your levels measured. Isn't that right?
See, what happens, people live in false sense of security by taking a simple multivitamin tablet or capsule. That only contains very minuscule amount of vitamin D. That is not sufficient if you are deficient to build up your vitamin D. So you have to take high dose vitamin D like 60,000 units every week for 3-4 months, then only you can build up your vitamin D level. And to maintain it, not only you have to take regular low dose vitamin D, but go out in sun for 45 minutes to 1 hour every day, walk for 45 minutes to 1 hour, at least 5 days a week.
Tell me this though, that normal, this is vitamin D deficiency in healthy people, so everybody should get probably tested for vitamin D levels. That's very important. But are there other conditions like genetics or medication induced which can happen?
Oh yeah, I mean there are two types of osteoporosis. One is primary osteoporosis, which is usually happens in female after menopause.
And osteoporosis means thinning of the bones.
Thinning or fragile bones.
Okay.
The bones which were strong, like in childhood when you jump from a height, you don't break the bone, but in elderly,
But too much from the height, you can break your bones, so be careful of that.
even you miss a step, you can fracture
Fracture.
a major hip bone or a spine fracture, or even sometimes coughing and sneezing I have seen can cause such major fracture of the spine.
Just coughing and sneezing.
Oh yeah.
That's
The
very
bones
important.
become so fragile and thin.
But you can have secondary osteoporosis, and we have a few case studies out here. Bushra is with us. तो बुशरा, आप बताएं, आपको कब पता चला कि आपकी बोन्स इतनी स्ट्रांग नहीं है?
एक्चुअली मैं सर्विस करती हूँ, मैं अपनी ड्यूटी पे जा रही थी तो मेरा एक्सीडेंट हुआ था। मुझे उसमें पता चला कि मेरी बोन्स बहुत वीक हैं। मैं नहीं जानती मैं डॉक्टर साहब के पास कैसे पहुँची।
Bushra has a genetic condition called spondyloepiphyseal dysplasia.
Okay, that's too
where-
long for me. Okay.
Yeah, where actually the axial skeleton as well as the spinal column and peripheral column both are reduced in height. So she is short statured. Not only she is short statured, her bones are osteoporosed or weak or fragile. And then hence when she met with an accident, she had very severe fracture around the knee with vascular injury, but timely treatment given to her saved not only her limb, but now she is able to walk and could go back to her job as a teacher.
तो वापस जॉब आप कर रही हैं बुशरा?
जी बिल्कुल।
Good job, Bushra. Very strong. Thank you so much, Bushra. Thank you so much. We have also somebody else, Mr. Kalam with us. तो काम जी, आप बताएं कि आपको कब पता चला कि आपकी बोन्स वीक हैं?
जी, मैं अपने घर के बाहर खाना खा के जो टहलने गया था तो ठोकर लग के मैं गिर गया। गिर के मेरा कंधा शोल्डर मेरा ज़मीन में लगा, तो उसमें मुझे महसूस हुआ कि ये मेरी हड्डी टूट गई। तो तभी मैं डॉक्टर साहब के पास में आया तो वहाँ पता चला कि मेरी तो हड्डी अंदर से खोखली है। खोखली थी
What is so special about Kalam's condition?
Kalam also suffers with secondary osteoporosis. He has history of chronic renal disease or kidney disease.
आपको किडनी की डिजीज है कलाम?
And that's why he underwent kidney transplant also. 1 year ago, he sustained a fracture of the wrist bone, and with simple fall, he got a fracture of the humerus or shoulder bone. And when we saw the X-ray and CT scan, we found that all the bones were hollow as if they were eaten away by some cancer cell. And then we had to use a titanium plate and bone graft and bone cement to fix. But this typically shows that people who are on steroids, who are suffering with kidney disease. Kidney is an important organ which actually metabolizes vitamin D. So if your kidney or liver is damaged, you do not do that and you end up having relative vitamin D deficiency and osteoporosis.
So that's a secondary cause of osteoporosis. तो कलाम, अब आप कैसे हैं? अब आपकी बोन्स थोड़ी स्ट्रांग हो रही हैं?
जी हो रही हैं। अभी 20 दिन हुए हैं। 20 दिन में मेरा हाथ सही आधे से ज़्यादा काम कर रहा है।
Very nice, good job. Good technology. Thank you so much, Kalam ji. आप आए, आपने हमें अपनी story share की. So tell me, before we go to break, I want to ask you about the DEXA scan or the bone density scan.
Yes.
Can you tell us who should do it and what does it mean?
DEXA scan is a simple X-ray based investigation which is done in 5 minutes and is available across most hospitals, where it measures the bone density of your spine, of your hips, of your wrist, which are the commonest site for fracture. So you can measure it, you can grade it as per WHO classification, whether you have mild osteopenia, moderate or severe, or you have severe osteoporosis. So all patients, all people above the age of 40, especially female, who are entering into menopause must have DEXA scan once a year.
On that note, we're going to take a break. There's lots more to come, including some physiotherapy tips and some eating tips after the break. Stay tuned to Let's Talk Health.
But I'm going to leave you on this part of the show.
Okay, Shobna, thank you so much.
Thank you
so much.
so
Being
much.
part of it.
Thank you.
Thank you. young people need not be worried about bone health. So should young people worry about bone health or not? Yes or no?
This is a wrong posture. If one goes and slouches back and slightly slides into the thing.
Hello and welcome back to Let's Talk Health, a public interest initiative by Apollo Hospitals. Now we are going to bust some myths about bone health and osteoporosis. So are you ready, Dr. Vaishya? All right, I'm going to need help from the audience. Are you guys ready? Yes. Okay. First question is, taking extra calcium can help prevent osteoporosis. So half yeses, half no's. Dr. Vaishya, is there a limit of calcium that we can take?
You see, calcium alone cannot prevent osteoporosis. You need to have right amount of calcium along with vitamin D and adequate sun exposure, and also regular exercises, especially weight bearing exercises like walking, brisk walk, jogging, etc.
So we have a lot of young people in the audience, so this will interest them. Young people need not be worried about bone health. So should young people worry about bone health or not? Yes or no? Okay, there were a few no's in the middle, but mostly yeses. So yes or no, young people should or should not worry about bone health?
See, since osteoporosis is a silent disease and it is considered to be a disease of elderly, most parents and most children do not know about it or worry about it. But I must tell you here that now it is thought that osteoporosis is actually a disease of childhood.
Childhood.
Because if you increase your bone bank account during your prime teens, before the 30 years of age, then you can utilize that bone bank which you have developed in early part of your life later in the life.
So what about, let's say if somebody does get osteoporosis, we have some people in our audience who probably have osteoporosis or osteopenia. So osteopenia means thinning of the bones and osteoporosis means that bones are very, very thin. So osteopenia is the first step, osteoporosis is the final step. So once you have osteoporosis, can it get better? Can you get to normal bone health?
If you have osteoporosis, now not only you can detect it in time, you can measure it, but certainly you can improve osteoporosis or bone density by taking several supplements, improving your diet, taking additional supplement, and there are now certain drugs which stop the decay of the bone, and there are certain group of drugs which actually increases the bone bank.
All right, that's a great point. And we have the last question is osteoarthritis. That means all the arthritis that you hear about and osteoporosis are the same thing. Are osteoarthritis and osteoporosis the same thing? Yes or no? And our audience is really good. So
Very
yes
good.
or no?
I'm impressed. Osteoporosis is a disease of bones where bones become fragile and tend to break, while osteoarthritis is a disease of joint where you have degeneration of the cartilage or damage to the cartilage, and that leads to pain, stiffness and difficulty in walking.
And all this talk about bones and osteoarthritis has given me kind of my bones are aching now. So I think to set my bones right, we have a physiotherapist with us today and a very special physiotherapist. Please welcome Dr. Seema Grover. She's the head of physiotherapy in Apollo Hospital. Dr. Grover, come up here. Dr. Grover has been kind enough and she's going to show us how to maintain the right posture.
See, initially maybe we talk of sitting posture, the way one should sit. It's like most of the people are working these days, if we say they are during puberty and stuff, and later on studying and being in the workplace. So sitting posture, one has to have the seat height as the length of the lower bone. It should be this high where the length of the lower bone, what we call as tibia, it should be the same height from the floor. And one should be sitting with the weight on both feet together rather than slouching. I mean, this is a wrong posture. If one goes and slouches back and slightly slides into the thing, you slide into the seat. Yeah, this is a very wrong posture. With many students, many people working, they gradually get into this posture. But one should be sitting more erect. The long bone of the upper bone, which is femur, should be settled into the seat, and the lower bone should be the height of the seat, right? And sitting erect, and if on table, then the elbows, the forearms should be supported. So ideal posture goes this, where one is more erect and stable.
Very good, Dr. Grover. Big round of applause to Dr. Grover. So, Dr. Grover, when you were showing that, I was looking at my posture, then I straightened it out. So thank you for that. But I think that helps us a lot because we spend a lot of time sitting, working on the computer nowadays. And if you are not careful before, then we can have a lot of problems later. So I want to thank you, Dr. Grover, and thank our audience member for coming on the stage. Thank you so much, ma'am. Thank you. Thank you. Big round of applause for Dr. Grover. Thank you so much, Dr. Grover. Thank you. So all that talk about posture made me hungry, and to talk about how diet can help us with calcium and vitamin D and supplements, please welcome Dr. Shikhar Sharma, dietitian. Dr. Sharma, welcome to the show. So Dr. Sharma, you're a dietitian. You talk to patients about how they can eat healthy, and we've got all this food on the table. So walk us through what are the good foods, what is good in calcium and vitamin D, how can we supplement our diet with good food?
Correct. So like, doctor had mentioned that we need vitamin D and we need calcium, and we need them together because only having calcium will not, affect us, because you need vitamin D for absorption of calcium. So let me begin by calcium sources. So egg is a good source, but it is a yellow portion. So a lot of people who are diet conscious leave the yellow portion.
That's right.
That's losing out on vitamin D.
I take the yellow out also, so I should not be taking that out, right?
Yes.
Okay.
So it's actually good for health. And similarly, fish is excellent source of vitamin D. What's also important is like sunshine is one of the natural sources of vitamin D. So when sun hits our skin, actually it converts into vitamin D. And also there are a lot of fortified products you get these days which also have vitamin D. Along with it, it's also important, like I said, to have calcium. So we have rich sources of calcium, like paneer is a rich source of calcium.
Paneer is a rich source.
Cheese is a very, very good source of calcium. Broccoli is a good source of calcium. Nuts are a very good source of calcium. Sesame seeds. A lot of people who are lactose intolerant, who cannot digest dairy products, ragi is an excellent source of calcium. Yes. Of course, you have dairy and you have oils, which are good sources. But despite that, like if somebody is already having osteoporosis or osteopenia, they might need supplements. Because it's not enough. And then you get supplements in the market like this sachet, basically you dissolve it in milk or water.
And what is it? What sachet is this?
This is vitamin D.
This is a vitamin D sachet?
Yes.
Okay.
And with that, you have calcium tablets which you could add on.
So the right stuff,
Yes.
everything in moderation, the right diet, I think that's very important. I think I'm going to eat all of this, especially the ragi and the egg yellow just after this show. Thank you so much, Shikha. I appreciate it. Big round of applause for Dr. Shikha. And that's our show for today. Remember, eat right, exercise, because prevention is better than cure. Thank you, goodbye, good luck, Khuda Hafiz. Thank you so much.